Hello, this is Jay Huang. I'm a pathology PGY4 resident in the States, and I go over almost on the daily cases that range from different organ systems from head to toe. If you're interested in that, I'd recommend you give a like and subscribe. Without further ado, thank you to Hologic for this pap smear case. Before we delve into pap smears, right now the date is June 2025. The American Cancer Society's most recent recommendation is primary HPV screening in women 25 years or older. So the HPV screening, it's important to look for high risk HPV subtypes like 16, 18, 31, 33. And if you have high risk subtype, then you can directly go to colposcopy. The way they do this is there's a risk stratification system. And if you have high risk, then you can go to colposcopy. So the key numbers you want to learn for boards and just for practical uses is 4% and 60%. Greater than 4%, you're eligible for a colposcopy. Greater than 60% of developing CIN3, you are eligible for a LEAP without doing a colposcopy. That being said, you want to also take into consideration the patient's preferences, whether they finish pregnancy, they want to get pregnant this year, and just you want to communicate with them. Now, without further ado, let's look at this pap smear. So here we have these cells compared to the intermediate cell. These cells are greater size in nuclei. This is a binuke, that's a sign of dysplasia, and you have this wonderful wire looping. And I'm just by looking at this wonderful wire looping and how crisp it is, I'm at Lsil already. Now you can see in the background you have inflammation, and you might think, oh, is this due to inflammatory changes that these are pseudocoilocytes? But this wire looping is too prominent for that to be pseudocoilocytes. And compared to your intermediate cell, you can fit 3 of the intermediate cell nuclei into this dysplastic cell. Here's another binuke. Here are some endocervical cells that are reactive with because of the inflammatory cells interspersed. Some other endocervical cells. It looks jumbled, but that's due to the reactive cells interspersed. All right. Endocervical cells are not required for adequacy, but it is a quality indicator telling the clinician that they have indeed hit the transformation zone, which is the tropism for human papillomavirus HPV. Now, once you find Lsil, right, you're not done, right? The most important thing that should be reflex is there HSIL. The whole point of PAPs are to look for HSIL, right? Because that dramatically increases your risk of squamous cell carcinoma. Lsil can regress. Now here we see these honeycombs without that much inflammatory cells. Maybe there's a neutrophil there, but these are just crisp endocervical cells that are in a sheet, and we're looking from like a bird's eye view from the top. So yeah, this was a good case, a very good case, I would have to argue, of Lsil. So thanks for watching. I'll see you next time.